Public Health has long said it hopes to mirror the implementation of medicinal marijuana after the state of Arizona. And what better way to get hands-on experience than to visit the Grand Canyon state itself?
Definitely the visit to Arizona has been eye-opening for a lot of things. We had several questions and they were answered. At the same time, there are further questions that needs to be answered.
Like Guam, Arizona's law was passed through a voter initiative in 2010. Michelle Lastimosa and Rosanna Rabago were part of the team who had a chance to visit dispensaries and cultivation sites, a total of 147 of which exist in the state.
So the dispensaries, what it means by that is those are those facilities where qualified patients or qualified caregivers would actually visit in order to obtain their medical marijuana. The cultivation sites are those facilities that are directly linked to those dispensaries in Arizona where they would actually grow the medical marijuana.
They also visited infusion kitchens where things like marijuana tinctures, ointments, and food products such as brownies, lollipops, and chocolates are made. But along with touring the sites, public health officials were also able to address problems the state has encountered.
Arizona's rules and regulations does not factor in a laboratory component in their rules and regulations. And we, in our program, decided that that was kind of problematic because you can have different types of marijuana products and they could have different types of concentrations, whether it's a high level of THC, a low level of CBD, and it can vary.
Public health officials also made their way to Steep Hill Laboratory in California. Steep Hill is an independently owned and operated cannabis analysis, biotechnology, and research and development facility. Another issue public health encountered was evaluation centers, specifically physicians taking advantage of the program and signing off on hundreds of certifications for medical marijuana.
But we realized from a program such as this that there are many opportunists who may want to take advantage of the system. So our visit was very revealing in that we learned a lot so that we can try and find internal processes to kind of prevent and control those things from happening here on our island.
Public Health say the findings of the trip will most likely result in a revision in Guam's draft rules and regulations. At least 3 public hearings are tentatively scheduled for next month. Reporting for Guam's News Network, I'm Ken Quintaniza.